presenting this data to CRI. From the earlier slide that we have already mentioned that the Navy system, they are in compliance to the lead and copper rule. From 2022 to 2023, all 90th percentile are below the 5 part per billion. So the system is deemed to have optimized corrosion control. The table on the slide shows more detail on the data that we get from last 3 rounds. So from 2022 to 2023, the Navy had conducted 3 rounds of lead and copper sampling. One of the sampling round has a range of detection from less than 0.5 part per billion to 14.12 part per billion. And this 14.12 part per billion is the only detection during these 3 rounds period. There is no site above the action level. Now we go to the LTM and EDWM data, which is labeled as non-compliant sample. The range of detection during that period, which has over 8,000 samples, is less than 0.5 to 63.4 part per billion. It's about 11% of sites with lead over 0.5 part per billion. And then there are 23 sites in the Navy system that over the action level or the screening level for LTM. That's equate to about 0.26% of sites over the lead screening level under LTM. There are a total of 49 lead and copper monitoring sites overlap with LTM and EDWM sites. And you see the number of samples 55, that's because there are more than 49 samples collected. So some sites have multiple samples, essentially. And I also want to point out that even though number of sites, at least the address, so while the address is the same, it doesn't mean that the sample is collected from the same faucet. During long-term monitoring and extended drinking water monitoring, these sites typically, they are the furthest point, such as second floor bathroom, whereas under the lead and copper rule, the monitoring sites are typically taken from kitchen sink. So in total, the range of detection, if we just comparing the overlap sites, is between less than 0.5 part per billion to 0.99 part per billion. There are 7 sites with lead over 0.5 part per billion, and there are no sites above the action level. Next slide, please. All right, so this slide is showing the Army system. And this table shows the most recent 2 rounds of compliance data. They were taken back in 2023. The range of detection is between less than 0.5 and 2.4 part per billion. There are about 30% of sites had lead over 0.5 part per billion, and there is 0 sites had lead over the action level during that period. During the long-term monitoring and extended drinking water monitoring, well, one thing I forgot to mention is the data that I mentioned in regard to long-term monitoring and extended drinking water monitoring is as of September 5th, because EDWM is still ongoing. So right now I'm just presenting data as of September 5th. So the range of detection during LTM and EDWM is between less than 0.5 and 82.7 part per billion. There are about 36% of sites that had lead above 0.5 part per billion. Less than 1% that there are only 3 sites above the action level or the screening level. if we just comparing the lead and copper sites that overlap with long-term monitoring or EDWM sites. Oh, sorry, Claudia, can you go back? Yeah, thank you. If you're just comparing the overlapping monitoring sites, there are 35 sites that overlap, but again, multiple sample have been taken from same location, so that's why number of sample is higher. The range of detections from less than 0.5 part per billion to 2.6 part per billion. About 20% of sites with lead over 0.5 part per billion, and there's no sites above the action level. So in summary, the comparison between long-term monitoring and extended drinking water monitoring data and lead and copper rule compliance data, they are not really apple to apple because the locations of the sampling sites are different. The sampling procedure for these samples are different, and essentially the data quality objective are different. Now I will pass the mic back to EPA. Thanks.
Thank you, Jeffrey. Okay, so this is our last section, and we really just wanted to take some time to discuss other lead initiatives that are being executed at a national and state level beyond what's being discussed in this forum through LTN and EDWM. So going back to the lead and copper rule that we discussed at the very beginning of this presentation, we're actually in a very unique period because the federal lead and copper rule will have undergone 2 significant revisions in these past 5 years. When the lead and copper rule was first published in 1991, it was done so to minimize lead and copper in drinking water, and this was kind of the first initiative. Then in 2000, there were minor revisions to the lead and copper rule that were introduced. And in 2004, there were technical corrections to the lead and copper rule. And in 2007, the short-term revisions to the lead and copper rule. And these were all more minor revisions. In 2021, the lead and copper rule revisions, or LCRR, was the first major revision to the lead and copper rule in 30 years. So since that 1991 rule that first introduced these sets of regulations. And it was really done to improve the provisions that to better protect children and communities from the risks of lead exposure. The LCRR comes into compliance on October 16, 2024, so in less than a month. And if that wasn't enough, on December 16, 2021, EPA did announce the development of a new regulation, the lead and copper rule improvements, to better protect communities from the exposure of lead in drinking water. This proposed rule is expected to be finalized literally any day now. So some of the key provisions of the proposed lead and copper rule improvements are achieving 100% lead pipe replacement in 10 years, also locating legacy lead pipes, and improving tap sampling. It's also proposed to lower the lead action level that we discussed thoroughly earlier in this presentation. And it's putting in provisions to strengthen the protections to reduce exposure. As we await these new lead and copper rule improvement regulations, EPA intends to maintain certain LCRR requirements that support the near-term development of actions to reduce lead in drinking water. These regulations are summarized into 3 main categories. The first one is lead service line inventory. So water systems need to develop and submit to the state an initial lead service line inventory by the October 16, 2024 deadline. And then they have to make an initial and an annual notification thereafter of any known or potential lead service lines to consumers. So this means if there are any lead service lines, or what we call galvanized primary replacement lines, or even unknown service lines, they need to provide this notification to consumers as part of the public education requirements. And then lastly, if there is any lead action level exceedances, it will be required to have a Tier 1 public notification And again, this is to make sure that we are communicating the risks of lead. As we mentioned earlier, any exposure of lead is important, and we want to make sure that consumers are aware of this. Now, all of these come into effect by the October 16, 2024 deadline, so very soon. The lead and copper rule revisions also introduced for the first time federal regulations for water systems to direct public education and lead monitoring at schools and childcare centers. We anticipate that these regulations, though, will be changing with the lead and copper rule improvements, as well as postponing the implementation date to begin the effect of these regulations. So it's not something that we will likely see come into effect on the October 16th deadline, but there will be more to come and more improvements for specifically for monitoring at schools and childcare facilities. But with that said, outside of the federal regulations, there have been many initiatives nationwide to test for lead in drinking water, specifically at schools and childcare centers, since young children are our most vulnerable population when it comes to lead exposure. EPA has a voluntary grant program to test and perform remediation activities at schools and childcare centers. And this is normally called the WIN 2107 grant. The Hawaii Department of Health has been allocated funding from fiscal year 18 to 2024 through this grant program, and they have also been working collaboratively with Department of Education in Hawaii. They've applied and been awarded funding for this program, and have also applied for a separate competitive grant called the Reducing Lead in Drinking Water Grant, or the WIN 2105, or I should say 2105, for the replacement of fixtures at targeted schools following the completion of the testing program. So I know Department of Health is going to talk a little bit more details on their initiatives at the schools and childcare centers. And also just to note, we are also in an unprecedented time where we've had a lot of investment in drinking water systems. The bipartisan infrastructure law provided $15 billion in funding through this Drinking Water State Revolving Fund program for lead service line replacements, because that is actually the highest risk for lead exposure in drinking water. The bill lead service line replacement funds, including set-asides, are for any projects associated and associated activities directly connected to the identification, planning, design, and replacement of lead service line. A lot of communities right now are using this and utilities to develop their lead service line inventories that are due on October 16, 2024. And lastly, I wanted to briefly mention that last year, EPA also announced the Getting the Lead Out initiative to expand technical assistance for lead service line removal efforts to underserved and disadvantaged communities nationwide, reaching 200 communities over the course of 2 years. And now I'm going to pass it over to DOH to talk about DOH's specific actions that they have taken to reduce lead exposure beyond what we see in LTM and EDWM.
Good evening. My name is Joan Clark. I've been with the Department.
Actually, I need to start playing this again. So give me a second.
Hi, Claudia. Is this another recording?
Some of the actions that the Department of
Yes,
Health
it
has
is.
taken
I'm going
to
to
address potential
go back
lead
and
issues
start
beyond.
again.
Can you go back one slide and then come back so it'll start over?
Good evening. My name is Joan Corrigan. I have been with the Department of Health Safe Drinking Water branch for a little over 10 years now. And I spent this last year as the Safe Drinking Water Branch Engineering Section Supervisor. Some of the actions that the Department of Health has taken to address potential lead issues beyond the LTM and EDWM. It includes working with public water systems, particularly the community and non-transient non-community water systems, including the Navy, Army, and Board of Water Supply, to develop service line inventories, which is actually a requirement under the lead and copper rule revisions, and the due date is less than a month from now by October 16, 2024. The purpose of the service line inventories is to identify the materials of the service lines so that any possible lead materials can be replaced. Now, the Department of Health has currently received funding from 5 different grant appropriations specifically to address lead in Hawaii. One of the grants was through the WIN 2107, and those funds were used for lead testing in schools and childcare facilities. And it provided funding to sample over 10,000 fixtures. They were initial first draw samples collected from 295 elementary schools and 117 childcare facilities statewide from 2021 to 2022. Of those results, around 46% of those facilities had at least one result above 15 parts per billion. Immediate corrective actions included communicating to each facility with one or more sample results above that 15 parts per billion, and blocking off access to the faucets and using filters. I'd like to just point out that this is similar to the actions that the Navy had to take whenever there were exceedances. So as a follow-up action to the lead testing in schools, where originally it focused on replacing fixtures where lead exceedances went beyond the 15 parts per billion. There was another grant awarded to the Department of Health and Department of Education, $1.4 million, that focused on further actions for test results that were above 5 parts per billion. Of those, it affected 170 schools, and the funding replaced just under 1,500 fixtures. And you can see the results on the website. The link is in the bottom right corner. And for the school summary, if you look at the image on the screen, the replacements have all been done, and the only thing that the parts in yellow and red are waiting for are the follow-up test results after the fixture replacement.
All right. Well, we're reaching the end. I'm just going to briefly show we have a lot of resources that provide even more information on what we talked about today, both from EPA's side. I've also included a link for the CDC's childhood lead poisoning prevention, where they talk specifically about lead in drinking water, and links to the Consumer Confidence Report. If you don't know where to find it, this will help you. And this is for any utility drinking water throughout the nation. And also Hawaii Department of Health's childhood lead poisoning prevention program as well. And a little bit more information on the lead and copper rule revisions and LCRI that we discussed briefly today. And since we talked about funding, I also included some additional links for our funding programs related to lead. And with that, that concludes our presentation. Thank you so much for your patience. We hope that this provided more information on lead compliance, on what we're doing for lead detections as part of this investigation with the Navy, and also general information of all of our lead initiatives. Lead is very important to us, and making sure that we communicate about it and minimize exposure of lead in drinking water. So with that, if there are any questions, we are open to taking any right now, or also offline as well.
Thank you, Claudia. Okay, I think there are questions. I want to start with the first question. Those last couple slides are obviously clickable links. Will these slides be provided? Yes. Okay, cool. And is it, I think we're going to want to put them on our CRI website so that the public has access to them too. So it's not just us here at the table, but the community who's watching. Is that okay? Do you?
Yep. Yes, I think that's okay.
Yeah.
Yeah, it is very much okay.
I appreciate that, Amy. Thank you. Mandy, you have your hands up. Let's go ahead and start there.
Yes, thank you so much for that hour-long briefing. I do have a couple of follow-up questions for the EPA. I was just perusing your website, specifically under lead, and the first thing that popped up is y'all's initiative that you're having next month. Could someone talk about what's happening the 20th or the 26th of October at EPA?
Can you give a little more background on that one?
Sure, I don't mind doing your job for you. The theme that you guys are having that week is Bright Futures Begin Lead-Free. And it's all about this, National Lead Poisoning Prevention Week that you guys are having. And I didn't hear you all mention anything on that, which I found kind of interesting. Because as you know, the military community, which has been predominantly impacted by this water crisis, there's a lot of children in our community, and there's a whole heck of a lot more children that live on Oahu that will be impacted from lead poisoning. And, I read on your website, it says your EPA goal to reduce childhood exposure to lead this is all about your month in October, and you've got this October 16th date coming up, which is awesome. I saw in your key provisions, number 4, it said that your goal is that you're going to be lowering the lead action level. That's going to be coming out on the 16th, right, of October. What is that action level going to be? Did you guys mention that?
That is proposed at 10 parts per billion.
Okay.
And I do want to clarify, sorry, Mandy, just to clarify, it's now coming out on the 16th. So that is the proposed LCRI action level exceedance. So when it becomes finalized, it will then have a compliance date, and that's when it will come into effect. So it's not coming into effect the 16th.
So it'll come out on the 16th, and we're having another CRI meeting, at the end of October. Is it possible to get another one of these briefings and how that new action level will then impact the numbers that you all have now? Because we're basing this off of, an old lead and copper rule, right? And there will be a new lead and copper rule with new numbers. And then obviously,
change.
Okay. On your website, it says EPA has set the max contamination level goal for lead in drinking water to, what was that? What's the number again? What's the goal?
0.
It is 0. That's awesome. Okay. So the last thing I'd like to talk about is you gave us these, like a bunch of numbers, right? And I think a lot of people on here really want to hear how it's going to impact their families and their kids. And I, for one, have 2 of them. Do you know, you talked about there were 2,224 total samples taken from 1,588 locations. How many locations are on the Joint Base Pearl Harbor Hickam water system?
I believe, aren't they all?
How many is that? If you don't have it now, could you write it down as a do out? I'd like to know. I mean, that seems, like not a lot of numbers. I would just like to know how many locations there are total. I'd also like to know, and maybe you could get this from the Navy since they're not here, approximately how many children are on the Navy's drinking water system? Approximately how many children are living on the drinking water system? How many children are commuting in to go to the schools on the Navy's drinking water system? And how many kids are commuting in to go to the Navy's child development centers? I'll give you one example. You talked about, you downplayed the significance of only 26, right, were above the detection level. One of those 26 locations could be the Ford Island CDC, where there are 250 children and a whole host of staff that are there. That's where my children went and spent 10 hours of their day, and we also lived on Ford Island. So when you throw out these numbers and you try to downplay the significance of the detections, think about how many people are impacted by one detection. And if next month is the EPA's initiative for children and reducing lead and all of the stuff that you talked about tonight, I would like to have another brief from you all next month that is focused on the thousands upon thousands of children who are drinking lead on that drinking water system. Thank you.
I'd like to just take a moment and that the last number of slides that were presented were actually about a significant number of those initiatives at reducing lead. So, you know, again, those are among all of the resources that EPA makes available. And so, but I do appreciate your comments, and you know, you're spot on, right?
Lewis, I'm a mother. I know I'm spot on because I have children who have been impacted by this. In those slides, you spent about an hour briefing us, and you spent about 2 minutes telling us about your new initiatives. So next month, could you focus the briefing on that? Thank you. I don't need a response.
All right, thank you, Mandy. Is there anything to prevent or to filter out lead? Can that be a follow-up question? Is to reduce those children harmed at the CDC? Is there something that can be immediately done to kind of control that?
Yes, actually, EPA has several filters that are recommended for the removal of lead, and that's actually in our website. That's actually something that we provide funding for as well through our grants for schools and childcares, because one of the immediate actions that can be done is to purchase point of use filters, and those work very effectively for removing lead. So yes,
okay,
we
great.
have those recommendations.
Is there a way that you guys, that the EPA can email that to the CRI as well, so we can also post it, and maybe we can have the Navy fund it? I don't know, just a thought. But Tara Rojas is next.
Aloha. And I know I'm on the panel today, so usually testifying, but I want to take this opportunity to say that as I was listening to this presentation, several things, you know, just kind of popped out, especially how almost just very contradictory. And for example, when you talk about that SPWA compliance versus special investigation portion of your presentation, and you mentioned about replacement, and then you emphasize, you know, as needed. So who determines, you know, the as needed? You said you had this many, I think it was like 8,000 or 2,000, I can't remember the exact numbers. But then what happens to all the others? There's a lot more that are affected. You only took, you know, samples from these. So like who makes the decision? Is that included?
I can talk about that.
Everybody, every house should
actually,
be that. Yeah, go ahead.
Yeah, so Tara, if you want, the long-term monitoring plans and extended drinking water monitoring plans are publicly available at the Navy site, and they actually explain in greater detail the corrective actions for any detections above the screening level. So yes, it is. It's something that is not only presented by the Navy as their corrective actions, but they do provide visibility to both EPA and DOH in terms of the corrective actions, and we do review those.
Okay.
So for those 26 detections that we discussed earlier, they actually did do fixture replacements for those.
Okay. So just to keep in mind now, though, when you go to a website and you have all these actions and there's so many things happening, is it easily findable? Is it easily understandable? Or do we have to hunt and look where exactly can we find this information? One, and then I'll just continue on first, and then you can answer after. Part comment and part from your presentation. You know, my comment is, you know, oil doesn't get removed, you know, from the flushing, basically. If I know you went to the technicalities, but I'm also going to add in that it just, as you're doing the presentation, just makes, you know, us so sick, or me personally, sick to see the map and to see that whole area, the whole water area, and including the land, the houses by it, is now like, you know, the Superfund site. And we're discussing this to the minute levels. And again, this was a clean, abundant food source. And so why I'm bringing this up, because we're talking about your Red Hill, yes, okay? And we also have to realize that just the other day was the RAB, the Remediation Advisory Board. So when you take a step back, it's almost like, let's contaminate, then let's set up a Remediation Advisory Board, or let's have, you know, the regulators, in this case for Red Hill, make like, you know, we can remediate, it will take our time, and gaslight with technicalities, and do this on repeat and in new places, because as we're discussing now, there is bombing, you know, continues happening like on Ka'ola. Why is it? It's the military. And to have to go through this like month after month and to have be presented now that, well, this is it because it's under 0.5, but yet 0 is the goal, but yet no action is necessary. It's just, you know, the Navy is doing us a favor to have to do this. And yet, and so what is this? So that's my comment. And two, my last question is, what is it that 10,000 number, 10 parts per billion? If you're saying you're trying to lower it, but it's now more than 5 parts per billion, can you explain that as well? And yeah, so those are my questions and comments.
Sure. So as I was trying to explain earlier, the action level is currently 15 parts per billion. The lead and copper rule improvements wants to lower that to 10 parts per billion. The real goal is to try and achieve 5 parts per billion. So the action level is lowering, but kind of what we consider truly optimized corrosion control treatment or really effective corrosion control treatment is when a large utility like Joint Base Pearl Harbor can get to 5 parts per billion or less at the 90th percentile, right? 10% of the samples can be above that, but 90% of those samples are below.
And yeah, and I'm going to reiterate what Mandy said. My last thing is that what are the health effects at 5, either 5 or below 5, on the children, the women, and the men, the people?
So for specific health effects, I would defer to either the Department of Health. We also included information from our partner federal health agencies, so the CDC or ATSCR, that have more information specifically on health effects.
All right. Thank you, Tara. Thank you, Claudia. I think that was. And I think the other Tara has a question, and then we'll move to Walter. We'll do Walter first.
Okay. First of all, I'd like to thank you guys for providing us that information and presenting the slides. I assume that the slides will be made available for the public and the CRI so that we can take a look at some of the information that you guys provided. So I just wanted to kind of summarize what you guys told us so that we all clearly understand. The lead and copper rule doesn't help us in terms of protecting our children. What you guys are monitoring and all these water samples do is determine whether or not the corrosiveness is efficient or effective or not, right? So if it's over 15 parts per billion, we do a little bit more for treating the system or do some kind of other magic tricks. So the 15 parts per billion is a corrosive factor, and you guys explained that. It's not a health-based level. EPA has told us, and we've seen in some of the publications, right? Lead is a neurotoxin. There is no safe level of exposure. You guys have said it, CDC have said it. We've seen some of the publications in ATSDR as well. So when we talk about lead, and Mandy's comments and her questions about how many children are exposed is really, really critical, and that is what we're asking, and that is what I think everybody is concerned about, and the response is coming back is, well, we got this lead and copper rule that talks about corrosive effectiveness. That's not what we're talking about. That's not what we're concerned about. So when we look at all of this data and we look at exceedances, we know that there's lead in the water. And you guys have this magic formula if it's less than 90% of the samples taken and so on. But that doesn't help us when we're looking at what our exposure is to our children. So when we look at the data that you guys provide and that's telling us that there's lead in there, what information, what actions are being taken by EPA, Department of Health, any of you guys in helping us get safer water, point of delivery protection? So earlier you mentioned there's a bunch of filters and there's a bunch of other things that are available. And we've looked at some of the lead scavengers and some of the other things as well. What can you do to help us get the Navy to do something to install some of these filters or whatever other actions or lead scavengers or anything we can put in to bring the exposures down to closer to 0? Not 5 parts per billion, not 15 parts per billion. We want to get it, as you mentioned, as close to 0. So with all your lead sampling, with looking at all this data and everything, at the end of the day, we need something that's going to be protecting our families and our children. So when we look at one other comment I want to make about all of the data, what we don't know is when they collect the data, when they collect the sample, are they following the requirements? And we just went through this whole thing with the 8,000 samples from the long-term monitoring. We found out they weren't taking the water samples correctly. They were cross-contaminating the samples between collection and analysis. So the data is tainted. How much of this data is tainted, and what kind of actions were taken to make sure that the quality control and quality assurance was in place and this data is actually accurate? So we don't know that, and please, we don't trust the data. So unless somebody can come back and tell us that they've done some kind of a review, a peer review would be nice. You've driven the CRI to look for other experts to help us look at the information that you provide and that the Navy provide that everybody seems to accept right off the top of their heads. We're at a point now where we can't just accept data and your evaluations without some kind of independent third-party peer review and that we really, really have to have. So that was one of our issues with the complaint. We did have somebody that looked at some of the information on the lead copper data. One of the questions that came up is the laboratory that the Navy uses, or the laboratories, because apparently there's more than one laboratory. The method detection limit for some of the LCR samples is 2.5 parts per billion, and then there's another method detection limit between the LTM and the extended drinking water monitoring at 0.13. Why is there a difference? Is there a difference in the lab? Is there a difference in the process or the analytical methods? That is one of our big questions. And finally, we've heard that EPA, and we've understand that EPA has taken a strong position about lead exposures. And in other areas, they've required additional or safe water sources to be provided, filters on the faucets and so on. Some of these areas in communities like Newark, New Jersey, Flint, Michigan, Benton Harbor, Michigan, Clarksburg, West Virginia, and some other areas where 15 parts per billion of lead were the results of the water sampling. So when we start looking at all this lead data, we look at what we're getting. Why isn't EPA taking a similar and strict position like they did in some of the other areas in the country? So if I can get some comments from you guys, I would appreciate it.
I can go first. Oh, sorry.
Okay.
Do you want to go first, please? That was a lot. I can talk about first lead testing in schools and kind of your concerns throughout the childhood. So I know that I recognize that there is maybe not a lot of trust with the Navy system, but I would hope that you would have trust in the Department of Health and the Department of Education of Hawaii. They have completed, as DOH provided earlier, lots of lead testing in schools and childcare facilities throughout the state. And this data is available publicly. And they found a lot of detections above their remediation trigger. Actually, I was just looking at their final report. They found 646 schools and childcare facilities that exceeded their remediation trigger. So meaning it was above the levels that they would then take corrective actions for. So that's a lot of schools throughout the entire state. So these fixtures and these lead issues, it's not unique to the Navy's base. This is kind of something we see throughout the entire country and throughout the entire state of Hawaii. So I would suggest to kind of look into that data as well, so you can kind of see what kind of lead levels are being seen throughout other areas and maybe areas that are throughout Oahu as well, and what actions are being done as well to kind of compare, because this isn't unique here. Lead testing and remediation is something that we see a lot in other areas, especially in schools and childcare facilities. So Lisa, you want to address any other questions? I don't think I remember.
Yeah, there was one question that I wanted to jump in on, which was about the potential impacts of kind of the contamination of the samples and stuff like that. And does that spill over, concerns about the TPH results and stuff like that, that may have spilled over onto lead? And I do want to say that that the concerns with the organic sampling it does not affect metals. And so metals are not impacted by chlorine and that sort of stuff in the water. At least not it doesn't impact the laboratory analysis. So all of the metal results are we are taking them all at face value.
And sorry, if I just want to jump in too. Walter brings up other comparisons of Flint, and I really just wanted to Google it real quick to give you a little bit of perspective. So in Flint, 17% of samples there were above 15 parts per billion. Here we have 0%. 40% were above 5. Here we have 0.3% compared to 40%. So it's really orders of magnitude less than what we saw in Flint. I don't want to minimize. No exposure of lead is good or acceptable. Completely going back to what Mandy said, what you guys have said. We're continuing to look at this and monitor this, but it's really important to put this into perspective with some of the stuff you might be hearing in the news about some of the other cities that EPA has and is dealing with about what these levels look like. And please do your own research with other cities. I just Googled that. I haven't done an exhaustive research myself on that, but if that's what you're concerned about is kind of comparing yourself to some of the other stories that you're hearing about in the news. We're trying to present the data here in a transparent way so that you can do your own comparisons if that's the level of what you're concerned about.
I am so happy you broached that subject because it's later on our agenda, so I'm just going to ask now. Will the EPA and DOH release the raw samples from the labs themselves to increase transparency? That's what will increase trust.
So I am trying to understand, I've seen this question before, raw samples
Raw data.
from
From the lab. The actual lab report.
of EPA's data or
Of anybody's data, the Navy's data, EPA's, DOH. I don't care, all of them. From
Okay.
every lab.
all right. I'd like to take that as a question and then I will get back to you all.
Okay, but I guarantee you the trust level will go like just through the roof, possibly.
I have a comment, a question too. So I have a couple questions. So who collects the samples? Is it the Department of Health or EPA? Do you folks flush before you collect the samples? It's not just about whether there's chlorine in there. Like, I think when you collect the samples, what sample collection procedures are you using? And then I would say, when it comes to trust, just recently the City Council unanimously passed a resolution asking for third-party testing for the pHs in our water. So that should be a signal to you folks about where we are. Like, that should be a real good reading about where the public is in terms of trust here, in terms of testing and results, and how the samples, who's collecting it, how the samples are collected, and the data that comes along with it. So I think and then to use Flint as kind of like the baseline for this, that's not appropriate, I think, at this point. Also,
Walter did ask specifically why the EPA isn't responding like we're responding in Flint, and so
and I will say this about the state of Hawaii, and somebody mentioned the state of Hawaii having all these lead detections. I don't know if you're aware of this, but we're one of the most heavily militarized states in in the United States. Oahu alone, 23% is occupied by the US military. So we're talking about lead samples across the state. My guess would be that these samples are taken from schools that are either on bases or are adjacent to bases. And that's just the bottom line. And I will say this, as a Kanaka Maoli who's very busy, as a community member who volunteers her time to come here, I find it very offensive that you guys would put out a recording you know, and you guys aren't even here in person. We make sacrifices to be here. We are here with good intentions for the future of our children here in Hawaii. And yet you guys sit there and give us this presentation. You lost me at 20 minutes, literally. An hour of presentation and charts and recordings, and then top it all off, the Navy's not even here. So I think, you you need to change the strategy to even say that you have the trust of the community. Is like, then that means you're really out of touch. Because you should have been at the city council meeting when the whole elected body of the city council unanimously voted for third-party testing. And that is a real sign of where the public is right now with the Department of Health and with the EPA. And if you're going to be in the Navy's ball court, right? If you're going to be on their team, then why are you even in existence? That's all I have to say.
We are not on the Navy's team, and I want to get back to your question about sampling, because I'm not certain as to which sampling you're talking about. If you're talking about the Navy's sampling under the long-term monitoring plan, that is their sampling. And some of the concerns that have been raised about how the samples have been taken, I would like to remind everybody that we have begun this effort of overseeing the long-term monitoring plan and how, what the data is showing, how it's been taken. We have sent out recently an auditor to review how they are taking samples. We have also been collecting split samples to provide a better understanding of the accuracy of their sampling. So there are a lot of different efforts that we are trying to do to have assurances that the data is accurate. Thank you.
Thank you, Amy. Do you know when that information might first be available? The laundry
report,
list you just gave. When can we see the clean laundry?
Okay, yeah. So the audit happened, I believe, last month. Report is due within 60 days. Okay. We expect our drinking water inspection report probably within the month. And the split sample results, we're going to be making publicly available within a month. And we will have it for the entire, we're anticipating having it for the entire extended drinking water monitoring plan process.
Thank you very much. So by the end of the year, we will have an idea of where things are. I just want to say that really, it hurts my heart to hear Jamie say that we aren't bad enough, we aren't sick enough, we aren't contaminated enough to warrant filters on our faucets. That breaks my heart. It breaks my heart to hear that we can't study things soon enough, right? Like we're waiting the tests are monthly when they should be weekly. That the sampling's done monthly and it should be weekly. And it takes so long to get the results back because we do not have a lab here, and we are not going to invest any efforts to try to protect us in the meantime by installing these kinds of filters that exist, but we're not going to use them, or not going to mandate the Navy to use them. That's just a comment. I have some questions. First, Luis, you said that you've never found a false positive lead sample. And so I'm wondering if you or someone on your team can help me understand what happened with the sample taken in 2019 from the Red Hill shaft pump head that showed 10.1 parts per billion lead contamination. Do you have any explanation for that extremely high lead detection in the water, in the shaft itself?
So there can be a number of different explanations for that, actually.
I just want the right one for this situation.
Well, I'm afraid I can't give that to you then.
Okay, is someone investigating this to figure out why there were 10 parts per billion of lead detected in the Red Hill pump shaft?
I mean, so please consider the ask, right, is that, how do we investigate a bottle, a sample that was collected 5 years ago? And so there can be more samples collected from the shaft. If that's the case, it is most likely that water was collected through a pipe that could have potentially had lead particulate in it.
Okay, so the sample was taken in 2019, 10 parts per billion of lead, and there was no follow-up. Like, I guess I thought I was asking for like the report from 2020 that says this is what was the story behind this 10 parts per billion of lead in the shaft.
Sure. I think better than just trying to guess at answers, I'm going to probably need to get back to you on that one.
All right. Okay.
Okay. I can add to that.
Can I ask a follow-up?
We're still
Sorry.
investigating.
So I'm just kind of want to beat off Marty's comment. So I have seen reports. One of my questions was, how do you know the lead's directly in the water system due to corrosion control or things that you're doing? How do you know it's not being drawn from the aquifer itself? Because that aquifer is hot for lead. Yeah. And I'm assuming now that it's not pumping drinking water, right? It's not regulated, right? So you're probably not drawing samples.
So I think kind of going back, Dennis wanted to chime in, and that was exactly what I was going to do. So EPA does provide their enforcement authority for the lead and copper revisions to the Department of Health. So they are the primacy agency overseeing and making sure that all the water systems in the state of Hawaii are meeting the lead and copper rule as incorporated into their state laws and regulations. So Dennis, do you want to kind of say something about the detection that they were asking about?
Yeah, there was one 10 parts per billion recorded reading off what we call a special sample. It wasn't compliance for compliance purposes. Unfortunately, the staff here at the time are no longer with us, so I don't know, why the Navy collected that sample. But what we see under the records is that there were samples taken after that, and there are non-detect. So there was no confirmation of that, yet the Navy chose to just report that data, and that's why it's in the CCR. And it's in 3 years of the CCR because they're triennial presentation.
Okay, Rosalie, can you please display the map? I have a question about, so talking about the lead and copper rule and the sampling that they did. I'm looking at this map. this shows samples taken in the blue by the Navy and in the green by the Army. And what concerns me is that this is supposed to, this map, this data was used, as far as I can understand, to say that the Navy is compliant, the Navy water system is compliant with the lead and copper rule. But my concern is that in this map, all of the Navy samples are taken in Kapalina at Iroquois Point, and there are no samples taken in all that space in between. And there was a map that Claudia showed earlier that showed us where those 26 sites were that had high detections, and so which are all in that Hickam area, that part in the middle that has no dots. Can someone talk to this map, please, and explain to me how this says, how you can use this as evidence to say that the Navy's water system is compliant with the lead and copper rule? It's problematic that all of the sampling for that rule, for compliance with that rule, is in one neighborhood.
Marty, could you explain where the map is from?
I got this off of the, I guess it's a lead and copper rule compliance map. I don't know, the link is there somewhere. Does that help to show you where it's from?
Sorry, it's really small. I'll keep trying to look at it.
So we took the data, the addresses that were given in the sampling reports, and then we mapped it, and it's all in one area.
Hey, Luis, can you explain tiering for them, please? I think you can do a better job than I can.
Sure. So one of the slides that I went over kind of rather quickly in my presentation talks about tiering of sampling sites. And so basically tier 1 sites are, there's essentially 3 tiers. Tier 1 and 2 are basically homes, single family residences and buildings that are either served by a lead service line or contain lead pipes, or they have lead solder that was installed between 1983 and basically whenever lead solder was banned by the state. Tier 3 sites are sites that have single family residences that have lead solder that was installed basically before 1983. So it likely has to do with the fact of when the homes were actually constructed. So if those areas were developed in that kind of post-1982 realm, and they had copper pipes and they used lead solder because that's what they used back then these would fall into that tier 1 category. And the lead and copper rule is very explicit that you have to sample from your tier 1 sites first. The rationale was that the newer lead is probably going to be the most problematic. It would have assumed that older lead would have kind of passivated over time, and it wouldn't be, most of what would have kind of corroded away would have probably largely done so.
So Kapalina was built in the late 1950s.
So yeah, I don't know the specifics of the system, so I can't speak to any further as to why the samples are in that area specifically.
All right, thank you, sir. Sorry, we're way behind schedule. We're trying to get back on track and give our water supply the time that they need. Melody, do you want to take a couple minutes and then we'll move on?
Just really quick.
Okay,
I think
absolutely.
because I'm trying to understand the chart that they've submitted, and I'm looking at the chart and they're showing tests in 2022 and 2023. Do we have any tests that were done in this year? Or not? Okay, that's one thing. How frequently do you test? Okay, and then it's showing number of samples. So 2022 first round was only 60 samples. And then second round, another 60 samples, 2023, only 36 samples. And then after that, it goes to non-compliant samples, 8,809 non-compliant samples. And then it's showing the range going from 5 parts per billion to 63.4 parts per billion, which is quite extreme. Can you explain these non-compliant samples and how does that then relate to where these samples were taken? And what kind of remediation, if any, is done? And I guess, is it from the source? I mean, now I'm really surprised that it might come from the aquifer itself. And if so, then what can be done? Is there bioremediation available, or already we've got legacy lead pipes? Are there plans to replace those legacy lead pipes? We know Board of Water Supply does not have any pipes like that because they're not having that type of positive samples detections. So that's my concern. And of course, again, the schools and the childcare and their location and being close to appears to be at Pearl Harbor. So that tends to tell me it's got to be legacy pipes. So will there be any replacements? Thank you.
I'll go first. So, let's see. I'm trying to remember all the questions.
Hang on
as
one
far
second,
as-
Claudia. Let's just, that was a lot. Let's,
I'm sorry.
no,
You always end
it's
up with a lot.
valuable. No, it's valuable questions. And I want to make sure that we have time to answer, but I also want to respect the other presenters. There's 2 more and we have 1 hour. Go ahead and answer that, but let's make it succinct, which I know you're already wanting to do, but I would like to have, I know there's questions online still that haven't been answered. Rosalie, you probably see those in the chat. Tara, I know you have your hand up, but if people can just put their questions in the chat, and then the people here at the table, if there are additional questions, we can pull them together and we'll send them so that they can be addressed with appropriate time on your guys' end, but our people can go forward. Okay, Claudia, go ahead.
Okay, I'm going to try to answer the ones I can remember, and if I miss any, just put them in the chat. So as far as lead pipes or really lead service lines, as I mentioned earlier, the lead and copper rule revisions requires that that the water systems provide an initial inventory of their lead service line by October 16, 2024. So this includes all water systems. So Board of Water Supply and the Joint Base Pearl Harbor HICM system, and as well as all the other water systems, will have to provide their initial inventory. So you will know, and you'll be able to find out specifically where there is a lead service line at both the utility side and the customer side very soon. And they do have to provide notifications to customers within 30 days of submitting their initial inventory. So I will say that about pipes. We don't expect to find much in Hawaii, to be honest. But you will know that information very soon. And as far as, I'm trying to remember now. I think I lost some of the other questions. But I do know that I was going to defer to Department of Health to talk about kind of the selection. And I remember there was another question about the non-compliance sampling, and I heard it was around 8,000. That sounds like it's the long-term monitoring and extended drinking water monitoring sampling. And as we described, it's related to an inspection from this fuel release. So yes, those are non-compliant sampling. All that data is available on the Safe Waters website, and that's the purpose of the efforts that were part of the long-term monitoring plan, and now what we're reviewing as extended drinking water monitoring. So separate from the compliance of lead and copper rule sampling and monitoring. And I don't know if anyone else wanted to chime in from the other questions that were asked.
Just one other thing that I kind of caught was that, the differentiation between the numbers, in that the lead and copper rule is basically sets a minimum number of samples. And for a water system of the size of Joint Base Pearl Harbor, they would, if they're collecting samples on a 6-month frequency, they're required to collect a minimum of 60 samples. If they collect on an annual or triennial frequency, they're required to collect a minimum of 30 samples. So that's kind of some of that differentiation there. We've been kind of trying to make that differentiation between the sampling that's required by the lead and copper rule versus the sampling that was conducted as part of the investigation of the impacts from the 2021 release.
Oh, we're going to pass it to Board Water Supply, Ernie Lau.
Thank you very much, EPA. We appreciate
Thank you, EPA.
Thank you very much.
Thank you, everybody. Am I on? Thank you, Alani. Aloha, everybody. Ernie Lau, Board of Water Supply. I have with me my Deputy Manager, Erwin Kawata. So since we were kind of referred to by the previous presenters, Erwin, maybe you can give a synopsis of what we found in our inventory to comply with the lead and copper rule revisions.
Sure, thank you, Ernie. So we have done our lead copper surface lateral inventory, and we have not found any lead in our water system. Our water system is primarily copper. It's like over 70 or 80% copper. There is some galvanized, there is plastic pipe, but we don't have any lead. Large water systems are required to make those findings available online, so you can actually go to our website. You can enter in a street name or your address, and it will actually tell you for that location what is the material of the lead service lateral for that particular location.
Thank you, Erwin. I just want to commend Erwin for his hard work on this. He started when these regulations came out. As soon as they came out, he looked at it and read it many, many times over and over, and started to do work to be sure that we could make a compliance in time, well ahead of schedule. And that's the kind of guy that Erwin is, and he. Our safety of our drinking water, I just want to commend Erwin. He's dedicated to keeping your water safe. Just some, maybe just an observation of the difference between the Board of Water Supply and the Navy. We have about 172,000 customers off of our system, so they would have service laterals, they would have meters. I'm not sure what the Navy system is, if they're individually metered, how they're set up. But one difference is all those customers, except maybe the ones that we own the property, we don't own the property beyond the meter. It's owned by private property owners. The difference, I think, with the Navy's water system is kind of unique. I think all the facilities that they serve by their water system basically sit on federal land. That it's owned by the Navy or the Department of Defense. So that's a subtle difference here. And I'm not sure who owns the structures ultimately that is occupying their property. If it's owned by a third-party contractor that they privatize the housing, or ultimately does every structure served by the Joint Base Pearl Harbor Hickam water system, is it ultimately owned by the U.S. Navy or the Department of Defense? And I don't know the answer to that question, but just a kind of an observation of some differences between that and the Navy's water system and the Board of Water Supply. In terms of the first question here, how does the Red Hill disaster affect East Honolulu? Our Halawa shaft was one of the largest water sources to serve Honolulu itself, including East Honolulu. From East Honolulu out here, there are actually physical pipe connections that run all the way to Halawa shaft. You can track, there is a pipe connection that leads all the way back to Halawa shaft. We have many sources feeding into the Honolulu water system, but right now Halawa shaft is shut off. So that was a decision we made in December 2021 after the Joint Base water system was heavily contaminated to actually shut off Halawa shaft. So that was done just as a cautious measure that I made the decision. I'm going to shut it off because I'm only 5,000 feet across Halawa Valley from the Red Hill facility. And I didn't know whether or not it could migrate in underground contaminant plumes across Halawa Valley and be pumped up into Halawa shaft. So that was my decision, our decision to actually shut off Halawa shaft, Aiea wells, and Halawa wells. Aiea wells and Halawa wells serve the Aiea Halawa community, not the Honolulu water system. So The effect of shutting off Red Hill Shaft is reduce supply capacity from our wells to serve Honolulu, including East Honolulu. So we've had to make that up with pumping other wells harder and even bringing water from as far away as Waipahu to feed and help meet the needs of urban Honolulu. Second question, any questions related to that? I'll just pause.
Oh, I have a question. So what is the Navy still over pumping their allotted amount of water from the Waiava shaft? Or, I mean, I just wanted, because the last time I was at the Seaworm, that was an issue.
The only remaining water source to serve Joint Base Pearl Harbor Hickam is their Waiava shaft over to the west at Pearl City area. I'm not sure, Heilani, if they're exceeding their water use permit. They're on a 12-month moving average basis. Any other questions on the first item? I'll move down to the second item, item B, status of monitor wells and data collection and sharing. And I'll ask Erwin to talk, who's also worked hard to site monitor wells around the Red Hill facility. We do have one under construction right now.
Okay, thank you, Ernie. So to start with, a monitor well is essentially a test well. It's a small diameter well that we drill into the ground, and the purpose is to collect information about the groundwater and understand the subsurface geology. It's not made to produce water for production. We have bigger wells to do that. So just to kind of explain to everyone what a monitor well is. So right now we have 2 monitor wells that have already been constructed. Like Ernie says, we have a third one that's under construction right now. We have 3 more that have been awarded and in the process of going towards construction. Hopefully those are going to start later on at the end of this year. Beyond that, we have another 8 more monitor wells that we're doing design for. So these are various locations. Some are close to our Halawa shaft. Others are farther away. As everyone knows, we don't have a lot of monitor wells, to the west of the Red Hill facility. So in the Halawa area, moving west toward the Āina area, we don't have a lot of monitor wells. So we have identified 8 additional ones that are in the design right now, and hopefully those designs are going to get ready for putting out for bid in the next 2 to 3 years, hopefully less than that. Okay. Of course, all these monitor wells have permitting requirements, and some of those permitting requirements are extremely difficult. So that's some of the things that's either slowing us down or things we have to go through that process to get the proper approvals. So that's beyond that. We do have another set of wells, what I call research type of wells, that we are looking beyond the Āina area up through the Pearl City area, because we want to try to get as far west as we can. Some of these are in the very early research stage. We're going to go out, look at the feasibility of installing these monitor wells. But as you know, as you take a look at a map, we are looking at a very highly built area. There's a lot of residential homes, there's a lot of houses, there's a lot of roads. There's a few parks. Certainly we don't want to drill a well in a park. Park space is very important to the community. So that's adding to the challenge. That in addition to the topography, in other words, many of the areas are not flat. There's hills, there's valleys. All of these things have to be overcome in order to be able to install a monitor well. So that's the current schedule now. Certainly all of the testing we're doing on the 2 monitor wells we have in place now, we do put that data or those laboratory reports on our website. It's labeled monitor wells, so you can actually go to them and actually see what we are testing for, petroleum hydrocarbons, PAHs. We are testing for those as well, also.
How much does the wells cost?
Right now, the bid prices are coming in close to $3 million a piece. And that's a lot.
Does that include the land?
No, that's just to construct it. So just to drill it, to put the casing in it, to install the final monitor well. It's about $3 million each monitor well.
So if you include the land, that could be $4 million?
Well, for the land, we're getting, we're not actually purchasing the land, we're actually acquiring what is called a right of entry. So we're working with the landowner, giving us permission and arranging for like an agreement that gives us access. Yeah, so we don't own the land, but we own the monitor well, but not the land itself.
$3 million, is that a monitoring well? $3 million is, what kind of well is that? A research well?
That's for
a
one
monitoring
monitor well.
That's a monitoring well.
One monitoring well, right.
Can you explain the research well?
Well, when I'm saying research is we're looking at other locations as to the feasibility of installing a monitor well. So we're kind of doing like a searching or what you call research, where we are looking at other locations, looking at the topography, looking at what's around there, maybe talking to the landowner, trying to get a feel for, you know, their willingness to allow us to put in a monitor well, and try to determine whether or not it could be feasible to do.
Can I ask another question?
Sure.
Okay, I know Board of Water Supply would like to see 100 monitoring wells. And the pace that you have given us, 2 to 3 years for the next 8, just on design, how long are you looking at then before we can really tell the movement of this plume?
Yeah, that is the problem. And Melody, I think you pointed out the reality is the difficulty of actually getting landowner permission, and I'm not trying to make excuses, but when we ask the landowners, they've actually been very willing to work with us, so we appreciate and mahalo them for that. Then it's going through the process to actually construct it. First, to get the permits in place through the Commission on Water Resource Management, because we need to get a well construction permit to be able to drill. So that is a process that takes time. So unfortunately, looking back, I first advocated for like 100 monitor wells back in 2014.
Yeah, 10 years.
So Melody, if somebody listened to me or listened to us 10 years ago, there would be a much more complete monitor well network that can help to locate contaminant plumes. So now we're in this mode of trying to do it all and it's not the main responsibility of the Board of Water Supply, it's the U.S. Navy, and they are trying to put in more monitor wells. They need to put in more.
Ernie, would you be able to explain the pros and cons of the groundwater monitoring wells? Is poking holes a bunch of holes through the earth directly to the aquifer good? What are the benefits of monitoring the plume versus keeping essentially a shield on the aquifer? I know in the lower access tunnel at Red Hill, there's countless borings that are direct access and kind of led to the spill, more contamination. So,
yeah. So as immediately below the Red Hill facility, below the bottoms of those tanks, and remember the bottom of the tank is about 100 feet above the water table, the top of the aquifer. So that rock is acting like a sponge, and we suspect, and I think the Navy and the regulators also suspect that there's fuel that's kind of hung up there. So as you drill a hole through it, are you going to create a what we call a preferential pathway for fuel to come out from different levels in the rock and then that flow closer to the groundwater below. So that has to be very carefully done. As you get further away from Red Hill, however, the fuel is actually starting to get into the groundwater aquifer and not being up at shallower depths. So the trick is finding what is the right depth of the aquifer that we're going to actually be able to detect the fuel contaminants. So close to the fuel tanks and below it, I think that's a concern. It has to be done very carefully. I don't think it's impossible because we also have the other problem. We need to figure out, the Navy needs to figure out how to remove the fuel and contaminants that's hung up in this area below the bottom of the tank and the top of the aquifer. And that could be 80 years worth of leakage.
Yeah.
And, one estimate from the Red Hill Vi is on the order of maybe 2 million gallons that had, at least from the limited records that we can see, that might have been leaked from the tanks or the pipelines at Red Hill. And Shannon, I think you would know even better the condition of that facility having operated in the past. I think Aaron, did mention about the exploratory wells that we are looking for water sources. Those are bigger wells. But all this well drilling right now, some of the challenges, there are only a few drilling contractors on the island. So between us and the Navy, we're giving them choke amount of work right now that they gotta go and bid on our jobs. So it is a challenging time. The next question was, has the Navy agreed to follow the BWS testing protocols? I would say, we're recommending, first of all, that PFAS testing be done. We've been asking for this for nearly 2 years now at all monitor well locations, including Red Hill Shaft, to get a better understanding of the nature and extent of PFAS contamination at Red Hill, which is a CRI Superfund site, and there is an active PFAS remedial investigation being formulated to be implemented. They haven't done that yet, although I'm trying to confirm with the Navy if they've actually agreed to do this, and they haven't told us that. But still, that's our recommendation. The other recommendation is that they increase the frequency of testing to weekly testing of the monitor wells. Because our experience with the Āina well and the PAH detections, which happen over a 2-month period, that the groundwater, regardless of what they say, that we think the groundwater flows pretty fast. And when it finds what we call a pathway, like a lava tube or the clinker zones between lava flows, that's where it tends to move really quickly. And I think that's the risk, that's the unknown risk. But to say that groundwater moves slowly, I think I would like to see the data and the reasons why they believe that to be true. But Erwin, I want to see if you want to add anything on the testing.
No, I don't have anything more to add to what you talked about. Thanks.
Okay, thank you. Next, question D. Summarize and discuss reports from BWS experts dealing fundamental flaws in the Navy's testing. I think that refers to the long-term monitoring plan and the Navy's swarm team and tech memorandum that they issued. And we'll be really quick on this. We did retain, and again, Erwin led that effort to find 2 independent experts to do a peer review of that swarm tech memo independently, not even knowing each other was doing the other person was doing the work, and they provided conclusions. I'll pass this to Erwin, but I would like to say that we've requested and we're willing to bring those peer review experts to the islands to attend the October 8th FTAC meeting, the Fuel Tank Advisory Committee meeting. It's going to be held at the Blaisdell, I think. And we've asked for time to do that, but we understand that that's a packed agenda that is set by the Department of Health. So what we're going to do too, and we wanted to invite all of you and the community after the FTAC meeting around 6 o'clock in the evening, come to the Board of Water Supply. We're going to have the 2 experts there to spend a couple hours just with the community, answering questions, going over in detail their presentations, and then opening up for questions and open discussion. So 6 o'clock after the FTAC meeting, come over to the Board of Water Supply. Parking is free, and you can do it in person, and we're going to also have a Zoom option too.
Okay, you had a question, Tara?
Matt Cohen had his hand up with a question, I think 2 questions ago, or 2 points ago. So I don't know if Matt still had a question.
Yeah, I don't know that it's really a question, but more additional information to add on to what Ernie was saying about the fuel, he talked about the fuel beneath the facility but above the aquifer. And, I think that I wanted to reiterate that our goal or our intent right now is to try to define what that is. And so the site assessment that the Navy is planning is the first phase, and they'll look for where have there been historic releases throughout the history of the facility. And then once we kind of have a sense of where those are, the Navy will oversee the Navy to define the nature and extent. And that'll help give us a place to go, and we can start to look at what kind of remedial technologies would be effective. So that is the focus right now.
Yeah, I just want to say thank you, Matt, for saying that, because we've been pursuing trying to get the Navy to disclose over its 80-year history what kind of fuels were stored there, what was leaked from which tank, what location of the facility, so that we have a better understanding that could help guide the areas of investigation.
Yeah, Ernie, if I can chime in real quick. So Matthew, those reports already exist for most of the tanks, so I would behoove you to go ask the Navy for them.
So I know from working on underground storage tank facilities for years, there are often releases that we don't know happened. And that's just the nature of how underground storage tanks work. And so, we can have a complete listing of everything the Navy knows about, but that doesn't give us a sense of that's not a complete picture. And so we sort of have to find a way to evaluate all of the potential releases. And so right now, the Navy has proposed to take various samples every 25 feet of pipeline and under the tanks. And so we think that will give us a good picture of where those releases might have occurred from. So that's where we're starting.
So Matthew, again, like drilling holes and drilling borings that already exist, those reports already exist. There are studies. Among studies, go look at the walls in the archive room. I mean, they already exist. Why would you poke more holes in the aquifer or to the aquifer just to evaluate it again?
These are not holes that go down to the aquifer.
But they're borings.
These are shallow. They're shallow samples there's a special kind of sampler. It's called a passive soil gas sampler, and you install it 5 feet below the tunnel floor, and it collects vapors that pass by the sampler. And so if there is contamination below that sampler, it'll pick up a signal, and we'll see sort of where these hot spots are along the pipeline, and then we can sort of say, okay, that's where we need to go investigate further. There may be a significant mass there. So that's the intent.
Yeah, thank you, Shannon. Are you referring to maybe the library at Fisk? Erwin and I have actually been in that room before. We noticed there's a lot of stuff on the wall and big maps and stuff. But I think all this information is helpful. But thank you.
I just want to add a word of caution. I want us to make really informed decisions. I'm also worried that we're going to get paralyzed by the need to know everything all the way before we make any decisions. Like, we are racing against the PFAS percolating down into the aquifer. We're racing against the plumes that are moving through the groundwater. And I would like for us to do whatever we can to take protective, precautionary action. Like, take actions as soon as possible and continue to collect information while we're doing it. But there are actions that we can take that can protect people's health. Like, I don't know, installing filters on the faucets. I can't believe I have to ask for this. And then there are things that we can do that can help to chase the plumes and figure out how to clean the water. And as much as I want to support everybody trying to find as much information as possible, I just want to be the voice on the other side that says we have to balance that with actual actions that protect us. Thank you.
Marty, we hear you.
Thank you.
And we agree.
Okay. Yeah, thank you. So I'll go back to the D, which is to summarize and discuss the reports that our technical experts evaluated on that Navy TPH technical memorandum. And it had to do with the analysis of samples over a 2-year period during that long-term monitoring period and analyzed for total petroleum hydrocarbons. And I'm sure everyone knows what the Navy's or that data said, that there were elevated levels, but the Navy came out with a report explaining that those elevated levels came as a result of interferences that came through the analysis of those samples and certain other technical aspects with respect to that analysis. And so we had a peer review experts take a look at those reports, and there are 2 basic parts of any analysis. Number 1, the collection of the sample, and number 2, the analysis of that sample. Both of those parts have very specific requirements that have to be followed. When they're not followed, it compromises the end product. So you could have a great sample collection, but a bad analysis and have a faulty test result. The same could be true where you don't collect the sample correctly and then you analyze it terrific and then you have a bad result. So in this particular case, our experts basically found the fundamental issue had to do with dealing with chlorinated samples collected from the Navy's distribution system, which was well known to be chlorinated, and there is a standard practice for or what is called neutralizing or dechlorinating those samples at the time of collection. That didn't happen. That overall affected all of the samples that was analyzed during that particular period. And it's an unfortunate situation that came up, but the data was clear in terms of what was seen as not happening. And that's an unfortunate part.
So I think it's, if we're able to get a copy of the extended drinking water monitoring plan, we'll do a quick review of that and provide comments, because it's very important that the sampling and testing going forward is done correctly so that the data can be trusted. It's a very unfortunate situation that 2 years of data for TPH is now in question, and the thing that bothers me yet is during the height of the contamination, the lack of a lot of good, reliable data on what people are directly exposed to is somewhat lacking.
It's my understanding that from the descriptions that we've gotten so far of the extended drinking water monitoring plan, that it in a lot of ways pulls forward the practices used during the long-term monitoring plan. I don't know if that's just other people's understanding also. Like, I'm really concerned that the extended drinking water monitoring plan is going to keep us in the same hole that we're in now.
Yeah, hopefully, the regulators will do a critical review of it and make sure that it's done correctly. And I heard earlier EPA sent an auditor down to audit how they're taking samples to ensure that they're doing it correctly. So it's very important. The data, all we have is data, and that guides our decisions. Next steps about item E. Discuss next steps now that the contamination has spread to IAL wells. We had those PAH detections, which we basically suspected there could be a plume. We don't know 100% it originated from Red Hill, but I look at what do I know? Where was there large contamination events in the area? And it kind of points toward Red Hill, but it points toward the need for more investigation to properly characterize the nature and extent of the contamination, not only going to the southwest, but also to the west and northwest of the Red Hill facility. So we are looking forward to the release of the groundwater modeling report, hopefully very soon. We're going to take a hard look at it and provide documented comments that will make it available to everybody.
I have a question, if I may, regarding the monitoring wells. Couldn't you just follow the pipeline going through the tunnels and starting to do samples from the tunnels? Because wouldn't that be a source of where the leaks may be at? And to my understanding, there's tunnels all underground, all over the island.
Yeah, I don't, well, I don't know about tunnels all over the island, but I think Matt was referring to some investigative work that seems to follow along the lower tunnel itself. And maybe Matt can expand on this.
Yeah, the tunnels are where the pipelines are that transmitted the fuel, and so those are the places that there are most likely releases, and so that's where we'd want to see the Navy investigate to determine if there were releases or where there might have been releases.
Can I ask, does the tunnel pass the IAEA well?
No.
No.
No,
So we're not
the
sure
tunnel,
how it got there then.
Yeah, the tunnel he's talking about is on the Red Hill property. In it has the pipeline that carries the fuel to and from the Red Hill property to Pearl Harbor. And that's where it's limited to.
So Melody, so there are buried pipelines everywhere. They're not in tunnels, but like I know of one from Red Hill, like at a 6-ish going to Pearl City, like at a diagonal. So there's buried fuel pipelines that back in the day, EPA will know this, you never had to abandon pipelines like properly. You could just bury them and leave them there. And so some were left with fuel, water remnants, and not filled with cement or dirt or whatever, or removed completely. So there is possibilities that those pipelines are rusting and oozing out fuel.
And those pipelines, you know, there was fuel facilities in different parts of the island too, in central Oahu, Waipio area, Kēkēmapa area too, and those pipelines, you know, ran all the way down to Joint Base Pearl Harbor too. So that's how we're trying to get a better understanding.
I think, Erwin, thanks for your analogy about the sampling. It's how we take the sample and then how it's analyzed are the two most critical issues. But because of this 8,000 samples of tainted data, and we know that we don't know if they can take the samples properly. And so when we look at lead and copper sampling, we're looking at pH sampling, PFAS sampling, the Navy's ability to collect samples and follow the procedures and then send them off without cross-contaminating them and having them analyzed properly. And we have all kinds of different labs and different contracts. So looking at collecting data and looking at our information and data, the integrity and the credibility of the data has been so questioned now that we have to ask, what is not being done in terms of collecting the data and analyzing it?
And that's absolutely true with respect to samples. I mean, even for us, we have what is called SOPs or standard operating procedures for everything that we do, including samples. And on a regular basis, quarterly basis, I have our staff and our processes audited as well. And so, yes, we do find places that we're slipping or we're making mistakes. We correct them right away. So hopefully this particular experience can translate some lessons learned going forward, especially toward the extended drinking water monitoring plan, where there are different types of analysis being done. Each type of analysis, the samples are also collected in different ways. And so make sure that each one, there is a procedure and it's followed and that it's regularly checked to ensure that it's properly followed all the way through.
Claudia, did you have a question? Hand raised.
I didn't have a question. I wanted to respond to some of the comments that were being made. I think that there was a request or a question about whether the EDWM is available, and yes, it is available publicly. You can see the version that was last approved from June, but there are more comments that we have provided to improve the plan itself. And I will say one of the things that I did mention is that the EDWM incorporated the learnings from LTM. One of the learnings was quenching. So if you look at the EDWM plan, even in the version from June, that has already been incorporated and it is actively being done to ensure that there is no more detections because of chlorine interactions with the surrogate. So that is something that's already been incorporated. And you can review it in the plan online.
Thank you. And Tara, did you have a question?
Yes, I'm going to go through it really quick. So one, going back to the cost of the wells, EPA and DOH, can you demand and put there that the Navy pay for this? They still haven't been held accountable, not even like just, they need to be held accountable and provide the monetary funds to pay for these. Two, the regulating, all you got to do at EPA and DOH, you know, you're supposed to just regulate and protect the public trust. So again, can you be aware that there's a difference when we can tell, we can trust you and whose, you know, side you're on. So again, when we hear BOW speak, we know that they're speaking on behalf, you know, of the protection of the people, which is actually your job as well. And so the FTAC meeting, I see in the chat that it's going to be October 9th, Wednesday at the Blaisdell. And yet, I was just going to type it, but you called me. I actually can't find the meeting, you know, online. I've been looking at all the places and Department of Health. So maybe if just DOH can make sure to get it up on the website so people can find it, we can post the actual official meeting minutes. And then finally, the again, if the EPA, you know, if you are doing your job and, you know, just and demand the Navy by this time release the list of contaminants, as you heard from, you know, Ernie himself say, as we heard him say at the City Council meeting, Navy, if you're listening, I know you're listening, please just let us know what we're dealing with. What's the list? And that is my concern, because if at this point, 3 years later, the early Department of Board of Water Supply is saying this out, we don't even know what's in the water. Please, with that just minimally, what should have been done right away, have them release this information so that BOW can make the informed decision. And this is a concern because, and I want to ask you, you know, like, I know, Tara, you're on that Red Hill Task Force. I heard, you know, when you were presenting that in that task force to help the affected families, you're saying that, you know, you're going to have the scientists look at and do the research and then find out what's in there. I'm like, it caught my ear. I was like, wait, why are we going to find out what's in there by this when it's the EPA and the Navy should have provided this already? And Ernie, again, each time he speaks, he's like, let us know. So with all those points, can you answer, and especially about having the Navy pay for these monitoring wells? Mahalo.
Hi, Joanna Sito regarding the FTAC. I've posted the link to the DOH FTAC webpage in the chat. The agenda and announcement will be coming out a week before, a little over a week before the meeting on October 9th.
Only a week before?
We are following the sunshine law requirement.
Okay.
Thank you.
Okay, thank you. Does that conclude your guys' presentation? Thank you, gentlemen. I appreciate your guys' time. Okay. We have 10 minutes. I want to move to propose that our third bullet item be bumped to next month, and that's Lacey Quintero talking about mental health awareness and just well-being in the face of environmental contamination. Is that, can I have a second or? Okay, we have a second and a third. All right, so Lacey, can we see you next month? Thank you very much for that. In light of that, however, September is Suicide Awareness and Suicide Prevention Month. And I just want to, even though we're not going to do the full presentation, I just want to acknowledge that living in a space where there is environmental contamination, it is extremely stressful and it does take a very significant toll. And if there are people who are struggling with that, it's okay to admit it, it's okay to acknowledge it, and there are resources available. If you do find yourself in need of help, you can dial 988 and reach available professionals 24/7. And you can also text the word home to 741-741. So if there is anybody in need of just talking through these things and the impact that it's having on you or the toll it's taking on your family, I just do at least want to acknowledge that, because that is real and it is something that we all are facing. Moving on from that, I do want to just acknowledge a couple of events that are coming up. The FTAC that was already mentioned, and thank you for getting the link in the chat. Last time I checked it, I didn't see the full detail of information put out, but it sounds like 1 week in advance, right? Did I understand that correctly? And then
Yes.
this weekend is Imagine a Day Without Water at the, can you please go ahead? Yeah.
It'll be at the Kapolei Regional Park across from the Kapolei Library from 10 a.m. to 2 p.m. Please, everybody, e komo mai. CRI will have exhibit area. The Hawaii Sierra Club 2 Board of Water Supply will have many things there. I think we have about 20 different exhibitors at the event. There'll be food trucks also, rain barrel workshops there. You can walk away with a rain barrel. Thank you. But you do have to pay a small fee. Yeah, but thank you.
Yes, good, thank you. The Red Hill Health Registry will
I have a
also
question.
have information there. Go ahead, Mandy, what is your question?
Quickly for Ernie, do we know if the Navy is going to be, setting up a booth this weekend?
I must have forgotten. I didn't invite them. Yeah, but maybe next time.
I think they call that karma, don't they? Thanks, Ernie.
Thank you, Mandy.
Quick question, Tara. Joanne, is it possible for the FTAC meeting to not be on a Wednesday, like smack in the work day from 1 to 5?
We will look at that as an option for the next one. Sorry, it's already set for Wednesday.
Also, can I ask that the redhillCRI be also able to present at the FTAC or be on that panel for FTAC? At least we have one representative from our group.
It is a Hawaii revised statute list of who the members are on FTAC, so we need to look into that. Thanks, Kalani.
Thank you. Another quick announcement is October 20 to 26 is the National Lead Poisoning Prevention Week and Information Week. So that was brought up earlier tonight, so I'm just acknowledge that again. And then I think Department of Health is also having an open house coming up on October 8th?
Yes.
Okay, can you give details
yes.
about that, where it is and everything?
Sure, thanks, Tara. It is 5 to 7 p.m. at Aliumanu Middle School on Tuesday, October 8th.
Awesome. And who is coming to that? I know EPA, DOH, the Red Hill Health Registry.
Yes, we also have the Navy attending. We hope to be able to share information that we are not able to share at FTAC due to the packed agenda that we are presenting.
Okay, I appreciate that. And then to piggyback off of Heilani's last question, is the CRI able to be there too?
I will look into that.
Thank you.
And get back to both.
Let
of
us
you.
know.
Thank
Yeah,
you.
yeah. That's all of the announcements. I know that we're right up to 8 o'clock, but we usually reserve time at the end, and it's normally an hour for public comment. Is there anybody here from the public or online from the public who has comment? I know we don't have a lot of time for it. You can also put it in the chat for us to compile, and we can take it and review it and send it to people as applicable if that's more appropriate. But Alan, go ahead.
thank you for the invitation. I don't really have anything to say other than what I put in the chat. I'd like to hear from Ernie about how he plans to find $300 million. I would say that Melody and I asked the congressional delegation for help, and Ed Case blew us off. And I've posted a question in the chat to ask the EPA to ask the Navy, since after all, the Navy is the one who created this mess in the first place. Amy Miller, if you're still around, why don't you ask the Navy to pay for these test wells? Thank you.
Thank you, Alan. Ernie, I'll let you start, and then Amy.
Yeah, thank you, Alan. So, you know, we are trying to talk to our congressional delegation through maybe the federal budgeting process. We do have also a $1.2 billion FTCA claim that's still out there. Well, they requested additional information. We provided, but haven't heard from them. Yeah. So that I guess that's all I had to say on that. Thank you.
Okay, Amy.
Yeah, sorry, my video isn't coming. Oh, there we go. We have required the Navy to put in wells. We cannot, we don't have legal authority to require them to pay BWFs to put in wells. But as part of the site remediation and recovery, we have required new wells to be put in place. Thank you.
If I could just really quickly just add the redhillCRI report outlines a request and the requirement for over 100 additional wells, and if this actually has to occur, I think at the federal level, someplace in federal law there needs to be maybe in the DoD's budget allocation that will be given to the state of Hawaii to pay for this ongoing investigation and remediation that the state of Hawaii and the Board of Water Supply have to now carry out.
Yeah, and Amy, just to add, you may not be able to go after the Navy or the federal government, but why are you not going after the contractors that caused the damage? They were doing the non-maintenance for decades and years, so why has that not happened yet? And to be quite honest, they're the ones that broke the system.
So our action, our current enforcement action for restoration is with the Navy. And we have asked them to put in more wells, which they are doing.
Question. I don't think it was answered quite properly. So like Superfund sites, right? If a company like Exxon, let's say they contaminate the site, it might not. So in this case, like there's companies working on Red Hill or have worked in Red Hill, and they were the cause of the non-maintenance. They didn't do the maintenance. They broke things. They spilled things. They didn't own the fuel. But why is the EPA not going after them monetarily?
Negligence. And I'd like to call on Dusty, who I believe is online as well.
Hello, everyone. I'm Dusty Miner. I'm attorney at EPA. So we're pursuing the Navy for the release. We are not pursuing, any of the Navy's contractors for the release, and the Navy is agreeing to do an investigation.
Dustin, can you come closer to the mic?
You can't hear me?
No. Yeah.
Can you hear me now?
Yeah, we can hear you. Just a little bit closer.
Can you hear me now?
Yeah. We want to know why.
We can hear you, Dusty.
Yeah, we can hear you. Just want to know why not pursue actions against the contractors.
Yeah, we're pursuing, I'm sorry, my monitor wasn't working right with the volume. Can you all hear me now?
Yes, we can hear you. Thank you.
We're pursuing the Navy. We're not pursuing the contractors. And that's really all I can, that's what we're doing.
So recommend going after the contractors since they're getting millions and billions of dollars from the government for not doing their job. Just a recommendation. Next question is from Patty. As more wells may need to be closed, where will water come from for East Oahu, East Honolulu?
This must be for the Board of Water Supply, and maybe I didn't answer the other question. So we're actively pursuing developing additional wells, new wells. And the first step in that process is actually drill an exploratory well to explore for water, the quality of the water and the quantity of water available at different locations. So we're going through that process right now to actually do these exploratory wells. We have 2 projects, I think, pending in the Āina area. And we're just kind of waiting on the permits.
Thank you. And another question from Meredith online. Can anyone remaining from EPA or DOH respond to why they allowed Navy to skip a step in their sampling method for TPH testing for years since the 2021 contamination?
So this is Amy, and I'll just say so this plan came into place under the long-term monitoring plan came into place in 2021, and as part of the consent order, we took over oversight in 2023 of the long-term monitoring plan. At that time, we began to look at data. Also, we stood up with you all, the Community Representation Initiative, and some of the feedback we received from you all about concerns led us to look at the data along with complaints and to dive deeper into the data. And it was from this that the Navy put together the swarm team and came to their understanding that the concern with the uptick in total petroleum hydrocarbon detections was from an error in not doing quenching. And so that's kind of how we see the sequence of events. I mean, we have been reviewing the data, and we continue to review the data, and we continue to do investigatory efforts because we do want to have sound data, and we want to have the drinking water system be resilient. Thank you.
Thank you, Amy. And I think Mandy's hand is up.
Yeah, quickly. I just have a clarification question about the wells. So I hear BWS saying that they ideally want 100 more wells, monitoring wells. And then I hear Amy saying that the EPA is requiring the Navy to put in more wells. Can you tell us how many more, Amy? Maybe I missed that. How many more wells are you requiring them to put in?
Mandy, I'm going to turn to Matt, who is the lead for remediation.
Okay.
Right now, we don't have a specific number that is the target. We're attempting to define.
Does it look something like 100 possibly, Matt?
There isn't a specific number in that way. we need to define the plume in a way that we have confidence that we know where it is and where it isn't.
Okay, my follow-on question to that, Matt, is are you working with BWS to figure out where they want these monitoring wells? And do you have any control as to where the Navy puts these wells? Like maybe where the BWS might want them as a compromise?
Yes.
So you guys can all work
Yes,
together.
there are extensive discussions with Navy, Board of Water Supply, and various other subject matter experts to figure out where the best place is to place wells and the depth to give us the best information to help solve the problems.
Awesome. And then back to Ernie. Ernie, do you agree with that statement? Do you feel like the EPA is working with you and hearing you as far as where you all want these wells, and you have confidence that the EPA is going to make the Navy do this and they're going to get done?
Mandy, you ask hard questions. Yes.
I know you're a very honest man, Ernie. I
Yeah,
just love your transparent
so
and honest answers.
Let me answer this. So there is something called a remediation roundtable, and that is created by the Department of Health and the EPA to bring in various stakeholders into that discussion about, I guess, monitor wells and many other investigation remediation strategies. So it's been underway for, I think now about 2 years. So we're providing a Mana'o where we are actually able to see the information or what's being discussed. Usually it's PowerPoint presentations at the meeting itself, but there's also a lot of offline discussions that we're not a party to, and we don't have access to the full amount of information. One thing that's been made very clear to us by the military is that we could get access to information, more information, if we signed a non-disclosure agreement, which we will not do. But one thing I've asked of the regulators to consider, and I still ask the question of them, is to consider how the remediation roundtable engages with the community through this process. Because as we move from defueling, cleaning the tanks, removing the pipeline, the thing that's before us for decades to come is going to be the investigation and cleanup. And it's, I think, appropriate that the community be kept informed about that process, and maybe be able to provide input too. So a community engagement process. Hopefully that will still be considered by the regulators.
Ernie, just quickly, I would like to recognize publicly as someone who's been impacted by this, I appreciate you, like the CRI, refusing to sign non-disclosure agreements and you keeping your promise to transparency to our community. Thank you.
You're welcome.
Okay, thank you very much. I think we're going to wrap it up. Thank you, everybody. If there was questions that we didn't get to, please put them in the chat before you disconnect. And if there's people here who have questions that we didn't get to, please bring them and we'll write them down and we'll get everything figured out and posted online. Thank you, everybody. Good night.
Thank you.
Thanks.
Good night, everybody.
Thanks for coming this way. We're just trying to get all the